Ischemic spine is most common cause of back pain. How to diagnose and treat. Chapter number 1, ischemic spine theory. What is ischemic spine theory? Ischemia means lack of blood flow. Lack of blood flow to the brain causes cognitive impairment. It makes you stupider. Lack of blood flow to the heart causes heart failure, and it makes you tireder. If the brain and the heart, the two most exalted organs in the body, suffer from a lack of blood flow, why should the spine be exempt? This is one of the most important concepts in all of health. If you want an organ system to function well, you want to make sure that it has good blood supply. And the most common thing people suffer from in this country is a lack of blood supply to their tissues. And by the way, lack of blood supply to the heart muscle doesn't just cause heart failure, congestive heart failure. It also causes heart attacks, myocardial infarctions, cardiac ischemia. It's all really variations on the same thing. Now, we're talking about the spine. So the mantra of spinal diagnostics is, where is the pain generator? We must find the pain generator. And once we've found the pain generator, the key site, the key level, we can then decide how to treat it. And the clinical history, the physical exam, MRI, CT scan, myelogram, EMG in some cases, they're all like on a treasure hunt to find the pain generator. And yes, of course, there often is an acute focal level that is the source of pain, the pain generator. And this sometimes is a big disc herniation, a big disc extrusion it's called, and that can be treated with surgery or with steroid injections, epidural steroid, transforaminal steroid. That's all well and good. However, the key point is, more often than not, what I see in clinical practice every day is multi-level spine disease. And by far the most common cause of multi-level spine disease is lack of blood supply to the spine with multi-level degenerative disc disease causing a cascade of events, like the domino theory of things that happen because the disc fails. And yes, we must look at the tree, but we should also look at the forest. If the entire forest has Dutch elm disease, will it be enough to just remove the tree with the most Dutch elm disease, the most severely affected tree? What if there was an antibiotic that could improve the function and the health of all the trees? This book explains how to halt the progression of degenerative disc disease in the spine. And what is the main point of this book? A high-fat diet of meat and oils is the main cause of diffuse degenerative disc disease of the entire spine, and that this process leads to failure of the entire spine. It's related to all these other spine diseases you will hear about along the lines of DISH, diffuse idiopathic skeletal hyperostosis, OPLL, and et cetera. We're going to talk about all those in just a little bit. Now, the vegan diet with no oils, kind of like the way Dr. Esselstyn does it and the way others have done it, is the fastest way to restore blood flow to the spine, to the brain, to the heart, and to the Johnson. Okay, what is our metaphor from the ancient Greeks? Our metaphor is going to be Theseus, controlling atherosclerosis. You are like Theseus with his sword to slay the Minotaur in the labyrinth. Okay, and the Minotaur is the representative in our metaphor of severe back pain. And the additional supportive measures like stop smoking and start walking more are Ariadne's thread to help you exit the labyrinth of back pain problems. So, what is the mechanism of ischemic spine failure? Well, the abdominal aorta runs down the abdomen right in front of the spine. Off the posterior wall of the abdominal aorta, you have lumbar arteries, which then provide blood supply to the spine. And as you can see in the picture, the blood vessel, the lumbar artery, runs about mid-height through the lumbar vertebral body. And then it gives off a small branch to the top and bottom of the vertebral body called the upper and lower end plate. The upper and lower end plate are largely made out of cartilage, and they have much less blood supply than the rest of the vertebral body. And then the disc doesn't even have a blood vessel. It just receives by diffusion some nutrients and has gaseous exchange, waste exchange with the disc through that manner. So even under the best of conditions, the disc does not have that great a blood supply. That's why it's so vulnerable. So ischemia causes the outer layer of the disc, the annulus fibrosus, to tear, and this sets off a cascade of events leading to a painful, weak, vulnerable, and eventually stiff and even autofused spine. When the disc degenerates, the outer part of the disc called the annulus fibrosus becomes weak, and the disc can bulge into it. Because degenerative discs are less able to provide support and bear weight, the vertebral bodies now have to compensate, and they do this by forming bone spurs. They form bone spurs that are called osteophytes. These osteophytes can compress nerves. And so the question of what causes the lack of blood flow, like we're saying, it's atherosclerosis in the abdominal aorta, which very often occurs more severely along the posterior wall of the abdominal aorta where those lumbar arteries come off. And if you look at CT scans, CAT scans of the abdomen, you will see this all day long. It is routine to see this in patients over 50, and I often see it in patients in their 40s, and I sometimes see quite a bit in patients in their 30s. I have seen this pattern many, many thousands of times. It is super common. And it's, by the way, the same patients that tend to have calcified coronary arteries also tend to have fireballs in the uterus, which is just a funny way of saying fibroids in the uterus. And they tend to have sigmoid colon diverticulosis, hiatal hernias, gallstones in the gallbladder, and all the other accoutrements that go with atherosclerosis. Atherosclerotic plaque tends to accumulate, and even have mural thrombus, big thick clots and plaque along the posterior wall of that abdominal aorta. So those lumbar arteries are not in a good location for getting blocked off by atherosclerosis and by blood clot. And once those lumbar arteries get plugged up, they'll often be plugged up at two adjacent levels. You really have very little blood supply getting to the spine at that level. And so the question is, well, why are the discs so sensitive? And the reason is because they don't have that great of blood flow even under baseline healthy conditions in relatively young persons. That's why you get infections more often in the end plate, because it's not that well perfused. It's a delicate, vulnerable spot. Okay, the main trunk of the lumbar artery, we've got a picture here. So here's the abdominal aorta coming down vertically in the abdomen, right in front of the vertebral bodies. Here's the lumbar artery coming off posteriorly. Lumbar artery runs at mid-height of the vertebral body. Here's the upper end plate, lower end plate of the vertebral body. And then a little twig vessel goes down to the end plate towards the disc. That end plate is what's called an apophyseal equivalent. It's like the equivalent of a growth plate in your long bones, like your arms and your legs. That means it contains cartilage. And now when we talk about the disc itself, do you know why walking makes your back feel so good? Because when you walk, there's alternating compression and decompression that sort of like milks the waste products out of the disc and lets the nutrients diffuse into the disc. And that's what makes your back feel better. Also notice your back hurts if you sit for a couple hours in a row without moving. That's because you don't have good blood supply to your spine. It's ischemic. Okay, so the sedentary lifestyle, the high-fat diet, all of those things work together to decrease blood supply to your spine and predispose you to increased risk of degenerative disc disease. Okay, now a little bit about the disc anatomy. The outer part of the disc anatomy is like a steel-belted radial tire, and it's called the annulus fibrosus. It's got these interlinking circumferential levels of thick fibrous collagen material. Okay, the center of the disc is like the center of a jelly donut. It contains this material called proteoglycans, which sort of are like a sponge. They soak up water. And the benefit is when you bear weight down on top of the spine, that disc distributes the weight equally, and so it's able to support a lot of weight. When you lose the integrity of the annulus fibrosus and the disc material starts spurting out in the form of disc herniations, that disc can no longer bear all that weight. And then that whole cascade of events happens in the spine. The disc can be thought of as being like a shock absorber or a cushion between the bones. Either way is a reasonable way to think of it.